Questions 781 to 800. 781. Causes of MI, blank. The answer is atherosclerosis, coronary artery disease, elevated cholesterol level, hypertension, smoking, obesity, stress. 782. Watery rice diarrhea, blank. The answer is cholera. 783. 71-year-old male was diagnosed with subdural underwent burr-hole craniotomy for subdural hematoma days ago. In order to detect the sign of meningitis, as one of which of the following indicates the patient has meninga? A. Negative Kernig signs. B. Positive Brudzinski sign. C. Absence of nuchal rigidity. D. Glasgow Coma Scale of 14 points. The answer is B. Positive Brudzinski sign. 784. A nurse evaluate dietary practices of a patient who had been as having acute glomerulonephritis. The patient verbalized following the appropriate diet for acute glomerulonephritis. Which of the following diet verbalized by the patient is approved diagnosis? A. Restricted fluid intake. B. Restricted dietary protein. C. Increase intake of low-fiber food. D. Increase intake of sodium-rich food. The answer is A. Restricted fluid intake. 785. Which of the following best describes the role of a case management? A. Promotes healthy lifestyle. B. Provides coordination of care to ensure continuity. C. Possesses highly skilled communication methods. D. Promotes the comfort of the patient. The answer is B. Provides coordination of care to ensure continuity. 786. A 3-year-old child is admitted to the hospital with seizures. He oriented and has a rash in his extremities and diagnosed meningitis. While doing physical examination of him, he starts to seizures. Blood pressure 100/57 mmHg. Heart rate 110/min. Respiratory rate 30/min. Temperature 39.5. Which of the following is the priority of care during the seizure? A. Put the child on right side. B. Protect the child from injury. C. Call the physician immediately. D. Administer oxygen 100%. The answer is B. Protect the child from injury. 787. A 5-year-old child admitted with bacterial meningitis and is having seizure. Which of the following intervention the nurse should initiate? A. Restrain the child's limbs to prevent injury. B. Slowly put the child on his side on the floor. C. Clear the area of objects and administer oxygen. D. Roll the child to prone position to protect the airway. The answer is B. Slowly put the child on his side on the floor. 788. In the summer months, a 5-year-old girl presents with a sore throat and a dry cough that has slowly become worse over the past 3 weeks. Her body temperature is 38.00 C. On auscultation, there is wheezing and shortness of breath. She lives in an overcrowded house with 3 brothers, parents and grandparents in a low-income neighborhood where she attends school. Which is the greatest risk factor? A. Residing in a low-income neighborhood. B. Exposure to a pathogen in summer season. C. Attending school. D. Living in crowded conditions. The answer is D. Living in crowded conditions. 789. A female patient diagnosed with cancer, she intended to spend a part of her money for the poor people in case of her cure. This action by the patient is considered A. Denial. B. Acceptance. C. Bargaining. D. Anger. The answer is C. Bargaining. 790. 70-year-old woman is admitted to the cardiac care unit with atrial fibrillation and is receiving intravenous diltiazem and heparin. What is the most likely nursing diagnosis? A. High risk for infection. B. High risk for impaired gas exchange. C. High risk for decreased cardiac output. D. High risk for disturbed sensory perception. The answer is C. High risk for decreased cardiac output. 791. A patient hospitalized with chest pain is diagnosed with angina. Which of the following discharge instruction takes priority? A. Recognize signs and symptoms that require immediate report. B. Maintain low cholesterol, low sodium, and low potassium. C. Carry heavy objects away from the chest area. D. Maintain physical exercise daily. The answer is A. Recognize signs and symptoms that require immediate report. 792. The nurse is assigned to care for a patient with Paget's disc complaining of bone pain. Which of the following conditions is this patient high risk for? A. Hypomagnesemia. B. Hypernatremia. C. Hypercalcemia. D. Hyperkalemia. The answer is B. Hypernatremia. 793. A 25-year-old primipper visited her primary healthcare clinic husband. He says that his wife delivered 5 days ago. For the past days, she is very irritable and crying for nothing. She is tired and sleep, and he is very concerned about her condition. Which of the following diagnosis by the attending physician will her symptoms? A. Postpartum blues. B. Postpartum psychosis. C. Postpartum depression. D. Postpartum anxiety. The answer is A. Postpartum blues. 794. A 44-year-old woman presented to the emergency department with eye pain and redness. She was diagnosed with uveitis related to a viral infection. The doctor prescribed dexamethasone eye drops. Where is the correct place to instill eye drops? A. Above the eyelid. B. Directly into the cornea. C. Into the conjunctiva sac. D. Outside the conjunctiva sac. The answer is C. Into the conjunctiva sac. 795. A 22-year-old man presents to the emergency department complaints of breathing difficulties. He appears restless and reports that he has had a cough with thick green sputum for days. The nurse performs auscultation over the lung fields. Blood pressure 130/80. Heart rate 100. Respiratory rate 24. Temperature 39. Which clinical finding is most likely heard over the right lower? A. Decreased vocal resonance. B. Decreased fremitus. C. Tympany. D. Bronchial. The answer is A. Decreased vocal resonance. 796. A hospitalized 72-year-old man who uses a walker is received medication and must use the bathroom several times each night to promote the safety of the patient. Which of the following appropriate nursing action? A. Keep the side rails up. B. Leave the bathroom light on. C. Provide a bedside commode. D. Withhold the patient's diuretic medication. The answer is C. Provide a bedside commode. 797. A man patient admitted to the medical unit was diagnosed with deep venous thrombosis, complaining of pain on both legs. Which of the following nursing diagnosis most likely describes problem? A. Risk for injury. B. Fluid volume excess. C. Electrolyte imbalance. D. Impaired tissue perfusion. The answer is D. Impaired tissue perfusion. 798. A client was admitted in the emergency room due to mild metabolic acidosis associated with dehydration and potassium. The doctor administered Hartmann's, lactated ringers, intravenous fluid and electrolyte replacement. Which of the following elements of the lactated ringers solution highest value? A. Calcium. B. Sodium. C. Potassium. D. Magnesium. The answer is B. Sodium. 799. A client with a blunt trauma underwent an exploratory laparotomy repair and intra-abdominal injury. A nasogastric tube attached suction and 2 closed wound hemovac abdominal drains. He is receiving an intravenous infusion of Ringer's lactate epidural with continuous morphine. 24-hour post develops hypotension, tachycardia, oliguria and severe nausea. Which of the following is the priority nursing diagnosis? A. Nausea. B. Risk for infection. C. Deficient fluid volume. D. Impaired urinary elimination. The answer is C. Deficient fluid volume. 800. The nurse is mentoring a newly graduated nurse who is right-handed 39-year-old woman who underwent a left-sided and is now in the medical surgical unit. The intravenous fluid to infiltrate into the infusion site and the student nurse's equipment to insert a new intravenous catheter. Which catheter insertion site would indicate that the new nurse needs to be corrected? A. A site that has soft and elastic skin. B. A site next to a joint. C. The right arm. D. A distal site. The answer is B. A site next to a joint.